Well, I have the pleasure today of talking to my friend Day Egusquiza. First time in 2022 that we've had a chance to visit. Day, it's so good to see you. Happy New Year. Here we are,
Thank
almost
you.
the end of February, and I'm wishing you Happy New Year, but we just haven't had a chance to talk so much. You have had a busy and challenging start to the year. As much as these conversations sometimes can sort of have a little political slant on them, whatever, we're not going to necessarily go there today. I know there are many opinions about what's going on right now. COVID continues to be the hot topic in our industry, and people that are vaccinated, people that are choosing not to get vaccinated, and all of that. And so we can maybe save the majority of that conversation for another day. But I know, generally speaking, that you believe all of us should do all that we can to keep the virus in check and help stop the spread so that we can get on with living as normal of lives as we can. But you've experienced this whole thing here most recently through a rather unique lens, and also in a more rural setting. And I think that's important for people that might have a chance to view this. Tell us a little bit about what you've been doing and how you've been doing.
Well, thank you, Bill. It's wonderful to be healthy enough to talk to you. As I've shared, one of us has had Omicron. So let's talk a little bit about what makes rural really unique. In December, Idaho was the first state to go under crisis standards of care. And in December, it was the Delta variant, and our hospitals were at capacity. We were sending our babies, our kids, to Oregon, which is about a 3-hour drive from Boise, our state capital. But Twin Falls, where I live, is sort of a rural hub for a bunch of critical access hospitals. And they've been closed during the crisis standards of care. Essentially, they said no room at the inn. And what it really meant when they were on, we were on CBS, NBC, CNN, and they were really talking about what that meant, because patients are terrified. You can imagine what it's like for our care team to have to say, we're going to have to ration care because we don't have enough beds. And then up north, in northern Idaho, they were even ahead of southern Idaho in declaring it. So it's one of those things when you say that, the whole community goes, and me too. Every Tuesday, I give my state a lot of credit here. Every Tuesday, they had a call with the big health systems, but a lot of our smaller hospitals and the Department of Health and Welfare, as they talked about capacity, as they talked about, we had one of our physicians, I'll never forget him, he's an intensivist in the ICU in the Boise Hospital, and he kind of broke down. And he said, in all my years of medicine, I have never seen this. And his nurses were crying on the TV. They were saying, we've never seen so many people dying. And so personal. Then what people didn't understand is it meant that, we have standards of care. Nurse can see 4 patients. We were having ICU nurses with 3 patients, of which all were COVID. And then we had our medical floors that were closed, and they had to take all COVID. So what was happening was people were being fearful because crisis standards of care says you don't have to maintain any standards of staffing. Mm-hmm. And you don't have to, when you go to the ER, you can say, I kind of related this yesterday when I was teaching at the Iowa HFMA meeting. It's like, remember the story of World War II and Pearl Harbor, and the nurse went and put lipstick on the head of the people who could be saved or not saved? Right. That's sort of like crisis standards of care. Now, good news is they kept saying we've never had to do that, but our staffing levels we have patients in the hallways up in northern Idaho where they brought a camera in. They had conference rooms that were shut and they became COVID units. This is a state that only has 2 million people, guys. Yeah. So when I'm sitting here telling you this, then think about all of our critical access hospitals. We only have about 8 that aren't. And so those folks are like, where do we ship our patients? Mm-hmm. Now we start having critical access hospitals taking care of patients that normally they never would keep. So we were in that standard. Every week they gave a report of all the hospitals. We came out of that in December, the end of December, so about 30 days. Then in January, we entered it again. This time we don't have any staff and beds. So now it's the Omicron that we are overwhelmed with in our hospitals. And again, the state declared it. And again, President Biden sent us National Guard. The governor sent us National Guard. The people were trying to help us again, but we weren't alone this time. If you watch the country, we weren't the only ones in crisis standards of care. Right. But the rural hospitals don't have a lot of choices to send our patients. So we have critical access taking care of patients that they probably shouldn't in any given day, but they have nowhere to send them. So we are out of that one again. So we've had 2. One was Delta, one was Omicron. But I'll share a last thought here too, Bill. One of the things that we as a country better be ready for with our rev cycle is the payers have now said they're not going to waive copays anymore.
Yeah.
That's huge because in the first waves of COVID, the average age was 72 in our hospitals. The average age with Omicron is 58. So if you think about that, your collection, your need to collect is going to be much higher. You're going to have to understand what's happening to your families. But that is, again, rural hospitals are with nowhere to send. And now we're going to have an awful lot of new balances due that people probably didn't expect. That was some yucky news that the payers sent out right at the end of the year.
Yeah, I imagine so. And a lot of this that you're talking about, you're not talking about spring and summer of 2020. You're talking about winter of 21, winter of 2022. And that a lot of this is still continuing to have an impact on the communities, and even more so, like you said, in the rural communities.
Our death rate is as high as it was last year, same month, without vaccinations. So that should tell you how we had a 45% positivity rate in January. We had more deaths than we had the previous year without vaccines.
Mm-hmm.
So it's kind of like we're one of the lowest in the country with vaccinations. So a lot happens that people don't appreciate, how even those of us that are vaccinated and boosted, we get sick because we can't fight it all off. So that's really an interesting time in rural hospitals. I keep telling them, tell your stories, tell your public. You are our heroes, but we also need to remember they're exhausted and they are having trouble keeping that massively good attitude that we need when we're sick. So I applaud them every day, but I also need to remind them to tell their story to their community. I think it would help a great deal.
Yeah, for sure. And let me just ask you, Day, on a personal level, you got COVID here not long ago, and you've had some lingering symptoms, but you look great today, and I really do hope that you're feeling better. But it had you down. It hit you pretty hard.
Yeah, I think I need to help a couple people stop saying mild. I'm not sure. Maybe there are people. I mean, I have no medical complications. I have no coexisting conditions. I was hit January 19th, high fever, sweat all over in my hair, and I went, geez, I must have a sinus infection. Never dawned on me I had COVID. Tested and started on steroids immediately to try to control the swelling. But the minute I went off them, I had the new symptom of radiating pain on my neck up into my skull, which inflamed that entire area. Mm-hmm. And it took another 15 days to get that under control. We thought I was well for the last 10 days. And Saturday had spasms in that exact same area, had admitted to the hospital to make sure I wasn't having a stroke, which was kind of scary, if you want the truth. Sure. And vertigo, and they were spasming all the way up and down. So we still don't know what's causing it. The doctor said they know that these are side effects. I'm in long COVID, which is not good news for anybody, especially me. But it's hard sometimes to keep positive attitude, because I know this was preventable, and I certainly shouldn't have gotten it, but what can we say?
Yeah. Well, and we'll talk about that a little bit more, but I'm glad that you're doing better, and we certainly wish you well. You had a big birthday this past year.
Yes.
You turned 30.
again and again for 35 years.
Talk about the transition to now being a Medicare recipient. How has that been?
Just cool or what?
Yeah.
People thought I was going to be upset to turn 65. I went, are you kidding me? I can't. I'm doing a happy dance all the way to Medicare.
Right.
Interesting, because those of you that know me know that I tell the story of what it's like to be a small employer and the kind of premiums we're paying for coverage. So when I had the opportunity to move to Medicare, I couldn't move fast enough. But remember, I'm also now one of your working agent, which means I'm over 65, still working. So your questions for me are always going to be, do you have commercial insurance primary to Medicare? Don't forget that, dudes. All right. Then I made the decision to evaluate traditional Medicare with a supplement versus Medicare Advantage.
Yep.
And I would encourage all of you to go and create your own. It's called mymedicare.gov. Put it in your social security number. You will learn enormous information. I had no idea that was out there. So when I did it for the first time, I discovered all the Medicare Advantage plans being sold in my county. It's county by county. So if you're a populated county, you're going to have a lot of options. If you're a rural county, you're going to have a lot less. And then I laid it up against traditional Medicare. And I have to tell you, Medicare Advantage plans are offering packages that why anybody wouldn't be in Medicare Advantage would be the question. They offer dental, hearing aids, glasses, gym memberships, home meals, care coordination. Who wouldn't want that? Right. And by the way, the premiums are zero. So these Medicare Advantage plans, when you see it on TV, and I yell at it because they are a tad bit misleading because there's always going to be a Part B premium. But I have to tell you, it was sort of a no-brainer for me to move. When I put on my provider hat, Medicare Advantage plans are a nightmare. Put on the patient hat, and hallelujah, what a package that is. My monthly premiums with Medicare and a supplement would have been about $380. To move to a Medicare Advantage plan and Part B, it's $175. $380, $175. Now, what the trade-off is you have to be extremely self-disciplined. And when I teach this, I always love the HFMA chapters going, but they don't save their money to pay their bill. Yeah. I know. But if you're just the patient living on Social Security, why would you stay with traditional Medicare? And so I think when President Biden tried to get through in his Build Back Better was dental benefits for traditional Medicare, and they never let it go, or to be able to negotiate pharmacy for traditional Medicare. You see, they can do all that with Medicare Advantage. So I'm not sure. I mean, yes, I know lightning will strike me, but yes, Bill, I moved to a Medicare Advantage plan. And I fess up, I did it. And I'm telling you, when you look at all the doctors who's in my network, there was no doctor I couldn't live without to save $250 a month, and realizing that I will owe a lot less out of pocket than if I kept traditional Medicare. So very interesting journey. And by the way, Social Security Administration called me and said, we see you're doing this online. Do you need any help? No. Are you still employed? Yeah. They said, are you sure you want to give up your commercial insurance? Which is hysterical, knowing that the Medicare Trust Fund is slated to go bankrupt, insolvent in 4 years. So, I mean, I was an interesting call, but I went, sorry, I'm not your, I got to go. I got to go. You got to get rid of this horrible insurance I have.
Isn't that something? Can I ask personally what your premiums were prior to turning 65 when you were a part of a commercial plan?
Yeah, it was $1,300 for my husband and I. $1,300 a month with a $4,500 deductible for each of us.
Yeah.
And then it was 70/30. So for that massive premium, I'm paying a fortune out of pocket before they pay a penny.
Yeah.
So it didn't take me anything. But now Darrell, my husband, he can stay on my commercial plan, which is interesting because it's a covered, and I chose to elect off.
Right.
We looked even to the marketplace for him to get coverage because he doesn't have insurance if I don't have it through the company.
Okay. That might be something that some people miss when they have a spouse that goes on Medicare and they're not. Yeah.
The exchanges there's a special, everybody has one in every state. All 50 states have marketplace or exchanges. And if you retire or lose your commercial, but in their world you're retiring, there's a special consideration that your spouse or yourself, because some people are retiring at 62. So take advantage of the marketplace, because that's where you should be getting your insurance if one spouse is and one spouse isn't, or you retire at 62 and you don't have anything. You should be looking at the exchanges.
But again, you said the website that you went to just kind of evaluate the different Medicare plans was mymedicare.gov?
Yes.
Is that what it was?
Yeah, and it's fabulous. I direct part of our Patient Financial Navigator Foundation every open enrollment period, which is in October to December. I help people with that all the time. And they'll say, well, can I go to an insurance agent? Which you can, but you want to be very careful. I mean, they get paid to sell insurance.
Right.
So it's really important to use but I always tell them to do this yourself. I write articles about it when Healthcare Buzz, and take a Excel spreadsheet, do this, because then they make good decisions. And whether they choose to stay with traditional and get a supplement, that'll be their decision. Stay on the commercial, not. You can do that every year.
So far there haven't been any gotchas or fine print that have snuck up on you, I guess. Just
no, and we'll see how that old ER visit 2 days ago was. That's going to be a monster. Yeah. But I always, because I have a lot of family who are in Medicare Advantage, I help them with their remittances and I do reconciliation for them. I've learned a lot about the two different, because I always say, okay, this is traditional Medicare, how would this pay? Now this is, oh, you have True Blue, this is how this pays. So I've been learning the differences in out of pocket. If people can't afford a supplement, which is very pricey, 180 a month, there's a chunk they pay more if they stay on traditional. Like to have a scope done, it's $200. That's all I paid, and it included the physician piece. Yeah, it's big, because like for a knee, the most I'll pay is 200. If I have an outpatient procedure, it's going to be 200. That includes the doc. There's no way Medicare traditional can compete with that.
Sure.
So they have a captive audience. They're ready to get all of us signed up.
Well, I know, and there seem to be more of them jumping into the game all the time. So